solo practice versus a group practice. How will this affect patient care? What if a doctor says, well, I don't want a mill practice. I never want to turn into that type of practitioner.
Well, a couple things. Number one is the technology in dentistry is occurring so rapidly that it's expensive. You know, CAD cams, CEREC machines, lasers, whatever you talk. Now you're talking about $100,000 a pop. Now, who could, you know, a dentist in solo practice cannot afford that, whereas a group can afford it because they have a larger entity, they can share equipment, they can do all of that.
So it improves.
So it will be dramatically improved. In addition, because they need less revenue to generate the margin or profit that they need, they can do they can begin to modify the dentistry, which is more preventative than fee-for-service dentistry, which is done in solo practice. You only get paid if you do something. You don't get paid for prevention in dentistry. But as this healthcare unfolds, as this entire change in the medical arena is beginning to be more outcome-based than fee-for-service based, as prevention becomes, it's just too expensive. Okay. So groups can begin to reformulate themselves to design the delivery of care so they can do intervention at an earlier point. Let me give you an example.
Okay.
Okay. So you're incredibly smart about medicine and about dentistry, and you know that risk factors play a huge role.
Okay.
Okay. Dentists don't control the risk factors. They're looking for a procedure that they can do because that's what they get paid for, not to reduce the risk. And so the bigger groups are going to start having risk management that the solo practices cannot do. And that doesn't need to be done by
That's very interesting. So they'll be able to get more involved in that risk management.
Right.
More involved in prevention where they couldn't afford to do that before?
Exactly.
That's something. So you're seeing that now with your group practices?
Yes.
And let me ask you this. So when it's all done, and you have a lot of these group practices that you've formed, what happens on the good side that the doctors didn't anticipate that they tell you? Is that one of them, obviously?
I don't think they see that as clearly until they move down the pike. There's some stages that they go through.
But when it's all done, what do they say? I mean, do they say...
What they say is thank you, because they now have a secure future that they didn't have before. They know that this group has a legacy. It has a succession. I can join a group. So when I get into a group, you can either buy a practice, and they usually do. They buy your practice, but they usually buy it for cash and stock. And so the stock value goes up the more revenue that they generate and the larger the group becomes. Now my stock has value. So the asset value of my entity, whatever I had in the beginning, is going up, whereas solo practice, if kept, is going down. And they don't have to worry about, selling the practice or who's going to move in or what do I need to do. Or they don't have to worry about management. They don't have to worry about HR. They don't have to worry about business and finance. They don't have to worry about that stuff. So really what the benefit is there's a lot less stress for the dentist.
Interesting. Now I know you can talk about this for at least 3 days because you do routinely, right?
To some degree, yes.
And what's the toughest part for you to get across?
The toughest part for me to get across is
to make them believe, I guess.
Well,
that it could be easy.
So 3 years ago, when I was delivering all this as a presentation, there was anger, frustration, and actually meanness, if I could use that word, in the room against me because I was talking about what's going to happen to the future.
Yeah.
So there's a wonderful body of work by Jerry Porras of Harvard. He calls it the change curve. The first one is denial. So they were in denial. And then they moved, the second one is anger. And they moved to anger. Now the third stage is acceptance. And we are here. We are at the border of acceptance.
And I heard you were, and I'm sorry to interrupt, but I heard you were on like this major website for dentists. And people were angry about this.
Oh, yes.
They were yelling at you if you could yell at somebody with type.
I had one death threat. That's how people
like, don't tell us that we're not going to be able to make a living now.
Right.
So
exactly.
But now, and that's changing.
That's changed. Now, I go into a room.
You're mainstream now. Dr. Mark Cooper's Main Street.
Well, I don't go that far, Randy.
Because I thought you were a little crazy when I first met you, by the way.
Okay, well,
I thought, I don't know. And now I'm a believer.
Well, thank you for believing, but it was tyranny of the obvious, for me. It was like, it's going to happen. Someone's got to talk about it. Someone's got to go against the strain that everyone's putting out that it's not going to happen. It's happened. My job is to get in front of it, not in the middle of it. And that's what I do. That's how I work. I
think, what I'm picking up, even what I've learned from today, from the moment you walked in, it's like I've made a change. And that is, I said, hey, present a good news message. Because you are presenting good news, because you're going to show them how to do it,
right,
how to thrive in this new economy. But I think what people are resisting, and what I was resisting, is you were telling the truth, and the truth oftentimes isn't always the best news.
Right.
Is that right?
It's just the news.
Because I'm no different than these doctors. They're going, oh, geez, I don't want to hear from this guy.
Right, right.
You're brushed under the carpet.
Well,
but now I'm just saying, in the beginning. But now they're going, oh my goodness.
Yeah, right. Well, now I have,
now you have
it's called proof of concept. If you look at how Silicon Valley works, you don't roll out a full product, you roll out one little piece and you say, this proves that it works. So I proved it. I have functional groups now that I've started from 1 doctor to 3 to 5 to 12, and I work with medium-sized group practices now. So, and if you take a look at Malcolm Gladwell's book, The Tipping Point, maybe you're familiar with it, he talks about when something reaches a certain percentage in terms of people accepting it and using it, then it becomes what everybody knows. Then the mid-adopters take it on, and then the laggards take it on. I mean, the whole thing occurs. Well, we're through the phase of innovators. We're through the phase of early adopters, and we are at the tipping point right now for group practice. Now there are about 15% of the practices out there are group. Before, when we spoke 2 years ago or whenever it was less than 8% or 7%. So the growth is dramatic. Its trajectory is pretty strong.
So they're talking about group practice.
Yeah, they're talking.
I always wonder what dentists are out there talking about. Now I know what they're talking about.
Well, they're talking about, I don't want to do this, but I have to. So that's the wrong attitude to take. What company, there's a lot of great companies out there. The fortunate thing that I've had in my career is that I've been able to work outside of dentistry. And so I've worked with some amazing companies. And I go into an Intel or a GE Capital, or I go into a Zappos, it really doesn't matter. It's like, wow, what if that were dentistry? What would that be like? What would that be like if someone had the managerial and leadership skill to put together an organization? Or you go into a great hospital like we talked about, Scripps or Anderson or any of them. What would it be like if dentists could do that? That's my vision. That's what I see as possible.
I've been told by consultants you're the most knowledgeable guy. I was told yesterday, the most knowledgeable guy in the business. Do you feel like you're the most knowledgeable guy in the business?
I don't know.
I know you're a humble guy, but you tell me.
Oh, it depends,
When it comes to converting a solo practice to a group practice, are you the most knowledgeable guy in the business?
Let me say it differently, because it might be more...
This is what I like about you. Very thoughtful.
Information without experience does not turn into knowledge.
Okay.
So everyone has this information. What I have is the experience. So you could say it's converted to knowledge. So in that regard, the answer is yes. I think I am more knowledgeable, but it's because of... I had a wonderful teacher, and you may know of him. His name was Joseph Campbell. He wrote The Hero's Journey and did the Bill Moyer thing. And he once told me, he said, if you see your steps clearly on the path, it's the wrong path. And so I took all these various routes with, outsourcing myself to major consulting companies and working in Silicon Valley and working with Fortune 500 companies. And so it all comes together now. Steve Jobs said at the Stanford graduation, I think that was him, he said, if you can't see the dots going forward, but you can certainly see the dots going backward. And I can see the dots going backward, why my career led to this point where I can bring my corporate knowledge and my group knowledge into dentistry at this point.
You picked a very tough
audience.
Yeah, because when you think about it, as a dentist, you're a science person, and they are taught, like most college graduates, to conform, to go with the herd, to follow the rules.
Correct.
And now you're telling them that maybe...
Yeah, the rules don't mean anything anymore. The rules were good in the context of the past, but in the new context, entrepreneurialism has a much stronger play than repeating the past and hoping that's going to give you what you need.